story that is as a result of the act of kindness. Like they say, a mustard seed is very small, but the proceeds of the mustard seed goes out, and you know, when you see the mustard, the tree that comes out of the mustard seed, you will know what it means to be kind to others. And so today, I'm so happy to just bring to you a beautiful story between the founder of HEPTO, Mr. Mohamed, Jama Mohamed, and the then young nurse, Madam Florence. And so welcome to the show. So before we went for the short break, you talked about meeting the young nurse. After all that pain, now you're in Isiolo. You're meeting this young nurse, please. Let's just go back to your meeting. How did it? Why did you go to Isiolo from Kenya? Why not take medication from Kenya?
I don't know why I ended up in Isiolo.
Okay.
I think that it meant to be that way.
Okay.
And my nurse, my young nurse, I call that time young nurse, she introduced herself
That is 30 years back?
30 years ago, Florence in time.
Okay.
And she helped me to she swiped a patient, as I said,
okay.
so that she put me a good bed direct to the TV, and also she stops every morning or every time she gets a shift. She asks me how I am. She gives me a little time. When she's making the rounds, a little time for myself, and also she.
And that time, you can't understand her language. She can't understand. So how are you guys communicating?
We were communicating a little English. That's what we were communicating through. My English was way less than poor, but she can understand me.
Okay.
She could, and then she asked me, Mohamed, I realized nobody visits you. Do you know anybody in the town? I said, no, I don't have anybody. And they said, when I come to work, if I bring you fruits, would you eat? I said, absolutely, thank you. So she used to bring some fruits when she's coming to her shift.
Yes.
And actually, it takes me, my thought, very, very deep. I thought deep. So why? Because why I think deep was my expectation was not what I get. My expectation, I don't know what I was expecting. I'm looking for medical treatment. I was a refugee man traveling in a foreign country without papers. My expectation was, okay, what can you do to you? Do they say we're not treating you? Do they say, why are you running around the country with the papers? Do they put you back to the camp? Do they put you back to a jail? Do they refuse you? What are they going to do? So my expectation, I received. What I received and what was out there in my mind was completely opposite. Okay. I received a very warm welcome. I received being treated like one of them, family member. I received even beyond the kindness, and nobody asking me any papers or any money or anything. I get the treatment I want, and that takes me the different level of thinking.
Okay. Let's talk to the young nurse then. The beautiful young nurse there. Then of course she's very beautiful. Yes. So Madam Florence, how was his state when he came to Isiolo 30 years back?
He had very severe burns. Okay. The burns were, you can see them now, the scars. The hands were out of the burns and the contractures. Okay. The chest, the face, the back. So it was severely burned.
Okay. So when you saw him, was it your responsibility to take care of patients like him, or were you assigned to him, or you assigned yourself to him?
No, I was not assigned to Mohamed only, but as a nurse, you get to know the needs of the patients.
Okay.
Not only giving the medication and not only the medication and the general care, you have to know the treat the psychological part of him. You have to know the patient. And The medication, the sympathy, there is also the empathy we give to the patients who need us.
Okay. And he mentioned something, you changed rooms. I mean, you gave him a better room, you switched patients.
Yeah, if I can remember, Isiolo made one and two big rooms where we had many beds and two single rooms, which were single, and one under TV.
Okay.
So Mohamed didn't understand any language. He was a foreigner. He spoke very little English. But for me as a nurse, I understand even patients who don't know how to talk. I can communicate with the...
You trained.
I tried. So I decided to swap him with another patient so that he can be communicating with the team.
Okay.
And 1 month after operation, he came to a new room with a new bed and a TV in front of him. He was so happy.
Okay.
Absolutely.
And you went ahead and even prepared meals. He mentioned you asked if you can bring fruits to him. Was that allowed within the hospital, or you just being kind to him?
The hospital gives patients food, but you can bring things like fruits, and he didn't have any visitor to visit him.
Okay.
So I became his visitor and became part of him.
Okay.
So I decided to bring him fruits and something which can make him a bit comfortable while he was undergoing the pain and the process of healing.
Okay. He's explained his burns to about 34%. And I know today, normally, when such patient walks in a hospital, you will be keen to know where is he coming from, who is he. Did you do that?
Before patients, when they come to the hospital, we take them as patients. We don't want to know where they're coming from, even their background.
Okay.
But during the process of healing, when we are with them now, we try to take the history, where you come from, who are your people. And that's how I came to know Mohamed as no family in my soul or in Kenya.
Okay. So after treating him, did you maybe want to know where did he go, or you just did your work normally and that was it?
When I was doing my work, I didn't expect Mohamed to come back and thank me or say that you did something good to me after while I was in hospital. And that time there was no communication.
Yes.
So Mohamed, after being disturbed, he went, and I didn't know where he went. I could not communicate. We lost the communication.
Yes. At some point, did you think of that patient, that Mohamed, how is he?
Even if I thought about Mohamed, now could I communicate with him? He was a foreigner. He left. I don't know where he went. There were no mobile phones like this by that time.
Okay. Thank you for that. She said about what she did, and that is where you left us. You've done this beautiful work. I mean, she's done this beautiful work. You're gone now. You've left Isiolo. So what happened after Isiolo?
After Isiolo, I came back to Nairobi. I started a process of, I went to the United Nations office. I started processing of getting some help through the United Nations in anywhere in the world, if we can get help.
Yes.
And that time, then United Nations, they sent me a doctor to evaluate me in order to get a medical report.
Yes.
And they sent me to Nairobi Hospital.
Okay.
And I sit with the doctor, which is, I think somehow it affiliates with the United Nations office. And when he examined me with a report that I was healed and I can go back to Somalia and still do the farming thing.
Yes.
And I said, there's no way to go back. And then United Nations saying, you know what, and this is an activist report, we cannot deny the doctor, we got this very weak report, we cannot do anything. And I still I didn't lose the hope, but I know I know there is a way. There is a way. I came back that day to the place I lived, and I just talked to my friends. And one Kenyan man, the older guy, the Kenyan, he knows me around, and he asked me my situation. I told the United Nations denied my case because of this report. And then he said, you know what, Mohamed, I'm going to take you to the Standard. Newspaper Standard, I'm going to put you on the front page of the News Standard, and we tell everybody the United Nations deny your case and you need the treatment. I said, okay, although I don't like the publication of my picture in the newspaper,
yes.
But I said, okay, because it was helping me. And we go in the morning, one morning we go to downtown of in Nairobi, and before we get into the Standard office, he stopped and he faced me and he said, you know what, I remember a doctor, a friend of mine I know, maybe I'll take you there take you to his office and see what he says. Maybe he has some idea. I said, okay. We go his friend, and that doctor examined me. He said, you know what, I'm a family physician, but one of our team is a plastic surgeon. He is in Nairobi hospital. We're going to send you to him, and maybe he will help you.
Yes.
I go to Nairobi hospital. I met the plastic surgeon. He examined me. He put a very good report. I love it. And he said, excuse me, Mohamed, we take this one, go to the downtown Nairobi, go to that office. Let that guy, the people in there, they will type it, bring it back, and then assign. In the morning, usually I have the bus fare. And my bus fare is exactly, I know how many rides I will have, and that's exactly fit. So when another plan comes in between, then there's no bus fare.
Yes.
And here's the doctor's office, and here's another doctor, and here one secretary sitting with a typewriter, another sitting with a typewriter, not a computer, the old typewriter.
Yes.
1991, yes. And then when I come out, I thought instead walking to downtown, and I don't have a bus fare, maybe if I ask these ladies if they can type it, they type and they go back to the doctor and they can sign. And I asked them, so there was the older secretary and the younger one. And then I have to choose which one I talk to. Yeah. I choose the younger one. And I think why? Because the young people are more sympathetic, they never seen a problem, and they most of the hearted. And then she said, oh, Mohamed, she said, I'm sorry, the office he sent you in downtown, he has a letterhead. It's a letterhead. And but if you don't have the bus fare, he is a 5 shillings to contain.
Bus fare, that was 5 shillings.
5 shillings. I said, thank you. I get that 5 shilling bus fare. I went to the downtown. I get the letter typed. I went. It was around 1:30, 1:40 that time. Then I tried to pray the midday prayer. I went the masjid in downtown, it's the Jama mosque in downtown Nairobi. And when I came back, I saw one guy I know from Somalia standing there.
Oh, okay. And a refugee too?
Yeah, he was a refugee too, but he was talking to some guys, and, but he was he was in Nairobi that time. And then I greeted him, and he said, Mohamed, what happened to you? And he said, you know what, that thing's happened to me, I get injured. But anyway, I need to go back to the Nairobi hospital, I need a bus fare. He said, okay, fine, then give me 20 shillings. I said, fine. when I get that 1 shillings, I feel hungry. Because I get money in my pocket and my pocket communicated to my stomach.
To your stomach, and so you have to honor the stomach.
Yeah, I didn't have a lunch or anything. I went back there, I finished the process, went back to sleep, and that letter is what the United Nations used for my report, sent to the American embassy, and American process, American embassy called me for interview 9 months later, and then I came to Philadelphia.
Okay.
December 9, 1992, I get into Philadelphia. That was the coldest weather I ever experienced as an African. I never had a kind of that cold. When I was in a plane, it says it's 20 degrees outside. But I thought that's 20 degrees Celsius. But it was not. It was 200 degrees Fahrenheit. So when I get out, it's the cold. I settled, I get a medical treatment from Temple University Hospital in Philadelphia. I went back to school. I get my life back. I always want to find a Florence entire again. I won't sit in front of her and say her thank you.
And in your story, you've met a lot of nice people. Why Florence?
Florence, truly speaking, she break the cycle of my thought. What my expectation, what I got, and what my expecting was completely different. Okay. She was one of the people who completely changed my thought. Wow. And she helped me when I was really needed. She didn't only help me physically, she helped me psychologically. Okay. And that is the 2, 3, 5 minutes she's talking to me when she's standing next to my bed, or when she brings me a fruit, that represents somebody caring about you. You have a value as a human. You are there, you are one of them, you are a person. That's a huge. In deep feeling, it's like a revival. Somebody bring your life again back.
So 30 years back, how did you? I mean, there's a lot of years. You're not sure whether Florence is there, and Florence also has moved on, and she's dealt with a lot of shit, and now you're looking for Florence. What was your first, or what? Knowing that we have the globe. You're wondering, how do I get to this Isolo among all these countries? How did you start? Who did you contact?
I was reciting the story all my life. So any person I talk to, I say, oh, this yellow, when I was in a hospital, there was a good nurse who took care of me. There was a good nurse who took care of me. And most everybody I talk to, I have a conversation with who knows me. They know about Florence. Yes, they know.
They must be excited.
So
having found that.
Then one in June, friend of mine visited this June this year. Okay. I think a month and a half or 2 months ago.
Yes.
He visited with his sister. And then he introduces, he said, Mohamed, this is my sister, Sadia. Oh, Sadia, welcome, and with Sadia and I will talk a little bit. I said, Sadia, where do you live in Kenya? And she said, Isiolo. I said, oh, yes, I have a good story in Isiolo. And then I started my story. And she said, I used to work in that hospital. I said, yes. Oh, but what time? What time did you start in 2012? So I'm talking about it 20 years ago, the day you started. Okay. But now it's 30 years. But still, when you come back, that nurse for me, the Kenyan nurse called Florence Lintari. She worked in that hospital for that time, for that year. She said, yes, I'll try my best. She has a nurse, she has a sister who's a nurse in Machakos. Okay. And Halima. And Halima Adam, she called, and Halima then she go her network, and she found Florence Lintari. Next morning, around 9 a.m., Sally texted me a number.
Where were you at that time?
in Minnesota.
Oh, okay.
And she texted me and said, "This is Florence and Teresa number."
I can imagine the
I couldn't wait longer. I dialed the number. I called immediately. And she picked the phone. She didn't know the number. She hung up. and then I said, "You know what? There's a better way." And I text her. And I text her and I say, "Hello, Florence and Tara, how are you? Probably you don't know me, but I was your patient when you were a nurse in Seattle Hospital.
Okay.
And 30 years ago, and my name is that, and I want to thank you."
So before you wrote the message, she hung up.
Yes.
Madam Flores. It is a strange number coming in. What came in your mind when you saw the number?
I didn't know who was calling, and I got. I didn't know who was calling, and it was a foreign number. You know how Kenyans.
How Kenyans, of course, when you see the
they don't know who is calling. So I answered, and then he called me. He texted me. He started introducing himself.
Oh, okay.
And that's how I got there. I told him I cannot remember you. That's a long time ago. And when we treat patients, we just give them the care, but we don't remember what we do good, but we don't remember what we did. But they do. So I have done a lot, but I meet with someone telling me, "You did this and that to me," but I don't remember.
Oh, okay.
So that's how I keep.
Now you're sending her the text message.
I was sending
introducing yourself.
And her first response was, "Hey, probably I did something good. I remember me that long." And I said yes, and then we keep talking. And the day, way back in 1981, the day I was discharged from that hospital, I asked her one question. I said, "Florence, you are one of the young nurses in the hospital, and you treat me beyond my expectation.
Yes.
What made you give me that care?" And she said, "I believe if I do good thing, I'll get good thing." That statement is printed in my memory. I never forget. And actually, she was right, because whatever we do or whatever we put out to the universe, that's what we get. So we make our life in a different way. And during that text message, I said, "Florence, do you remember the question I asked you 30 years ago when you answered this way?"
Oh, she gave you the same answer she gave you, 30 years ago?
Actually, I reminded her, she answered me, my question 30 years ago, I get good thing if I do good thing. Yeah, so I say, I thank you very much, and probably you'll be blessed all your life. And I'm so happy to find you. And I tell everybody, and I'll go to my work, and I say, "Oh, do you know the nurse I was telling you? Do you know the Kenyan nurse I was telling you me 30 years ago? I found her." And be surprised. How? How did you find her? You really? So it was very exciting. It's I thank you very much, and I thank you and your team, and actually it's your personality, your thought, and your training, and everything was it helping me. And also you planted a seed in my mind, and that seed was to help and care people. That made me to go back to school and become a nurse. I've been a nurse for long. I am a nurse. Anytime I have a patient, I remember you. I thought I need to care because Florence care.
She actually passed the good virtue.
Absolutely.
Wow.
That seed germinated, that seed is harvested and feed all over the world now. It's in the United States. So I bet a lot of my patients appreciate the work I do, and they do. My coworkers too, and you are part of it.
Thank you so
I think you're part of me, you're part of my profession, and you're part of humanity. I thank you very much what you did, and I think I don't know what to say. I don't know how I can express that.
Okay.
Yeah.
Madam Florence, you talked about some beautiful things and your responses towards his messages. So after he introduced himself, were you able now to know who he was?
He reminded me.
Okay.
And so I told him it's a long time ago when we met, but because they have reminded me now, I can have just a clue of what was a long time ago. Yes, and I was happy that I inspired him.
And so he's saying he became what he is today because of you. How do you feel as a mother? How do you feel as a professional out there that somebody somewhere is touched by what you did, is seeing you as their role model by your act of kindness?
I feel so good. I feel blessed, Mohamed, that I inspired you to become a nurse and to do the good things you saw in me. And that's good of you. I'm happy for you.
Thank you.
Thank you. That is so emotional. I don't want to be carried away to the beautiful story. Now, Mohamed, you've met Florence. Any plans you have with Florence?
Florence is my family now. So I would say I would consider as a family, as a best friend of mine, and I'm so happy to meet her. I founded this organization, and this is a non-profit organization, and I want to put something back to humanity.
Yes.
I know I can do a lot. I know we all can do a lot as a human, and then I want the Florence is be a part of my humanitarian mission to put something back to the humanity. And I hope one day we can work together in Kenya and reach a lot of people who need the help.
Yes.
We can lift a lot of people who cannot stand up themselves alone. And we will contribute a lot to humanity again. So we need to plant more seeds.
Okay.
Yeah.
There's a lot of relief-based organizations around the world. And what makes HEPTO different from them?
HEPTO is completely different. HEPTO, because what I want to improve is what I went through.
Okay.
I was a refugee. I was a young boy growing up in the farmers' village. I walk my school. I know how the life in Africa is in here. Need to correct. I know what the people missing. I can relate the problem our society have today. That's one thing. And second, we are not giving like a pain reliever thing of relief. We are changing the mindset, the way the people can stand on their own feet, and solve their problem. And that will come through training, through education, inspiration, motivation, and then show how we can stand on our own feet, and we can do the things we need to be done. And so it's just kind of like HEPTO is a changing mindset. And that's completely different than what the aid.
There are a lot of people, Mr. Mohamed, from our communities who would really benefit from what HEPTO is doing. What plans do you have in order to be able to reach out to them?
And first of all, we need to register the organization here in Kenya.
Yes.
And after we register it, we have the short plan, we have the long plan, We visit the community hospitals, especially the rural areas where they don't have enough equipment. We try to equip the hospitals for the medical equipment from the United States. Train the people to use this medical equipment.
Yes.
Train the biomedical technicians to repair if they didn't work or the problem should. And then we try to, we will bring the knowledge or technical and whatever we think we need to improve in here. Also, we have a lot of nurses, a lot of doctors, a lot of healthcare workers in Kenya who is well trained, who have well experienced.
Yes.
We can use that one to reach the rural areas and also the small towns to spread the knowledge, spread the skill, and then every person can get the health care they need in the closest place. So it's like the teamwork, society work, community work. So that's what we're thinking.
Okay. I believe there is, for community empowerment, I believe there are some threefold approach. Maybe working with the government official, you might even work with the leaders, or rather the locals themselves. So what is your approach towards the community?
The community, we approach the community leaders, community figures,
yes,
the school teachers, the religion, the any sector in the community, and in that way they will be the part of HEPTO and will be the part of the community, and in that way we can work together.
Okay. Okay. I've seen you doing an amazing job with Ethiopia, the Jigjiga University Hospital, and I can see the hospital has about 972 staff. And so under your programs, I see you are also doing COVID-19, emerging diseases, mental health, chronic diseases, women's health, surgical services. Are you going to offer all these programs to Kenyan?
Absolutely, and beyond. And we are not only we're not only bringing something to Kenya. Kenyans, they're well educated. They are not receivers. They have a source too. But we work as a community. So all the things when we bring, we get the feedback, and then we work together as a team, as a community, and see how we can go from there. Do we need to focus on mental health? How is the mental health issue is? What we can learn from the world? How we can improve? What are the surgical services? What are the environmental services? So I saw the other places I've been in Ethiopia and Somalia. Some community hospitals, they don't have the proper way to dispose the hospital waste, the medical waste, and that's when they dispose the wrong way. They put it in a big hole. It's open. Rain comes. The wind, it contaminates the rest of the environment.
Yes.
Then we thought how we can focus on that one, which is the environment. How we can dispose the hospital the medical waste. How we can. So it's a community work. It's a society work. It's working together. So yes, all that things that have to want to focus every sector of healthcare. We see how we can improve. How we can improve the chronic health, the chronic diseases. How we can improve mental health. How the other people do their mental health. Where we can go from here. And actually, the whole East Africa, and we connected. So if some disease happen one place, it can get the other. So it's a teamwork.
Okay. I can see the Jigjiga University Hospital in Ethiopia is serving about a population of 12 million people from the east of Ethiopia. And Kenya, just the county which we are broadcasting, is about 6.2 million, meaning if you're coming in Kenya and you're offering the amazing services, everyone would want to come in so that they can also be beneficiaries. And HEPTO is a non-profit organization. How are you going to manage to supply to such audience or other population?
we work with the hospitals.
Yes.
And we do the assessment.
Okay.
We listen to each other.
Mm-hmm.
We take the recommendations.
Yes.
As I say, we are not bringing an idea and expect the people listen to us. No, we listen to them.
Yeah.
And then together we find a room we can work together.
Mm-hmm.
So suppose if we need a hospital, so kind of hospital, we need a 30 beds or 60 good beds, how we can find it, then we go and get it. If we say, you know what, we needed to create these services like dialysis clinic services, how we can find the equipment and whatever we need for the dialysis service, then we work together. So that's the most of our work is the teamwork.
Okay.
And I hope we will come up with something good.
Okay. Are you going to partner with the local NGOs or other the non-profit organizations?
Absolutely. We open to partnership with every organization, private and non-private, government. And our end goal is to help the community. So whatever we can get that, we really...
Yes, so you're open. Yes. Okay. And are you open to donors? You know, you're serving a very high population. I'm using example of Ethiopia, the Jigdag University, serving 12 million, population that is high. And you know, when you come to Kenya, it will be even, the demand will be high. So are you open to donors coming in, or you already have enough contacts to service the demand?
Donors, they are part of the humanity and they're part of human being. They are part of the community, and we welcome them. We open for the donors, the contributors, and they can welcome, they can donate, they can advise.
Yes.
And we open, locally, globally. Yeah.
What you're talking about is huge. Apart from Florence, are you having other licensed practitioners in Kenya who are willing or rather already signed to work with you?
Yes, I have a lot of friends, mostly nurses, and they are well experienced. Halima Adam is one of them, and they're willing to work with us and direct us and advise us, and work together, and we can go from where we are to better place.
Okay. Yeah. When are you planning to finalize on your local registration?
We're going to start as soon as possible. We're going to start this month or next month.
Okay.
And then we just wait. I don't know how long the process may take, but we will see.
Okay. Madam Florence, as we wind up, would you kindly just tell our viewer your last remarks on the kindness you did to Mohamed and how the future, what holds in your future with him, or rather the youngsters who are coming up and they feel like that was meant for our forefathers. I mean, we have a common phrase in Kenya that kila mtu na. So what are your last remarks to our youths who are coming up, and out of what you did to Mohamed, that is why it's good for you, and I'm seeing something good is being helped.
Okay, thank you. For me, Mohamed, I say thank you. I've never seen someone who has taken that struggle to look for me for 30 years. I'm happy that I inspired your life. And whatever I did to you, made you become a nurse, and you want to give back to the community. Thank you so much. And for the young nurses, what I ask of you is to do good, always good to your patients, and leave everything to God. In Kenya, we say that tenda wema nenda zako. You do good and go your way. How do I translate? Yeah. The good will follow you. So anytime you attend your patients, do everything that you can to them. Those who are, they need the support. I know what for nurses, you give the psychological part of it, the spiritual, and the medical part of it. Yes.
Thank you. Thank you so much, Madam Florence. Mr. Mohamed, Jama Mohamed, founder of HEPTO. Your final remarks for viewers.
Yeah, I thank you, Florence. I thank you very much for the opportunity you give us. I thank the audience to the time to listen to this story. Life teaches us a lot. And if we just look back at our past, it's amazing. The way I experience the treatment I get, Florence and her team is yellow, that changed my thought and changed my thinking for the last 30 years and maybe the rest of my life. And remember, whatever we did to others, it will happen to us.
Yes.
So it's better to choose a good thing and good thoughts. So another way is we make our life from our thinking. And so I hope the world will be a better place if we take one extra step for humanity.
Yes.
And humanity is a lot of things to do in it, and there's less competition, so it's open for everybody. So I thank you very much, and I'm very grateful to meet with you today. And actually, that's a very good feeling. I accomplished a lot. Thank you.
Thank you.
Thank you so much. Thank you so much for joining the show. Like we said earlier, a single act of kindness is like a tree that spreads all directions and again gives back to many more trees. Wherever you are, please embrace kindness. And you know, at the end of the day, we will have a nation that has a lot of trees that are always kind and providing shelter and providing the best fruits we need in our continent. Thank you so much for watching. My name is Priska Achuki.